Hello, and welcome to Standard 9 of the Care Certificate Workbooks. My name is Daniel Dutton, and I run the website dsdweb.co.uk, which provides free help, guidance, and support for people that are studying for care qualifications. In this video, we will be looking at Standard 9 Awareness of Mental Health, Dementia, and Learning Disability. This standard looks at some of the things you need to know about working with individuals from three particularly vulnerable groups. They are individuals with dementia, individuals with learning disabilities, and individuals with mental health conditions. For further information about this standard, visit dsdweb.co.uk by clicking the link in the description. Try to relate the information in this video to your own practice and write your answers in your own words. Before continuing, I'd be grateful if you could click the thumbs up button to like this video and subscribe to my channel. This helps promote the channel on YouTube and makes it easier for others to find it. Thank you. The first question asks how an individual with certain conditions may feel and how it can influence their care needs. The conditions listed are anxiety, depression, psychosis, dementia, and learning disability. The current slide shows some of the feelings that individuals in these groups may experience, and the next slide shows how it may affect their support. I'll try to switch slides about halfway through the talk, but I'll apologise now just in case I forget. Individuals with a condition that causes anxiety may feel scared or worried almost constantly and will struggle to remember the last time they felt relaxed. We all experience anxiety in our lives, such as before taking an exam or speaking in public. I, myself, get anxious before recording one of these videos. And, for the most part, this is a useful reaction because it increases the heart rate, keeps you alert, and focuses the mind on the task in hand. However, individuals with an anxiety disorder feel these effects almost all of the time, which, as well as being draining, are also debilitating. Individuals with an anxiety condition will often need reassurance and encouragement to manage their day-to-day lives. They may also need assistance with treatments which can include CBT, relaxation techniques or medication, and support to attend appointments with their GP, psychologist or counsellor. Like anxiety, depression is a condition that has symptoms of feelings that are overwhelming and persistent. However, where anxiety is related to feelings of worry and fear, depression is related to feelings of sadness and despair. Whilst we all have low points and low moods in our lives, an individual with clinical depression will almost constantly have feelings of unhappiness and hopelessness and display a lack of interest in doing anything. This can also lead to feelings of isolation because they can alienate themselves from others. An individual with a depressive condition will usually need a lot of support to perform daily living tasks as motivation will be low. They will also need support and encouragement to attend health appointments and make changes to their lifestyle that could improve the condition, such as healthy eating, exercise, and social participation. Some treatments for depression are talking therapies, CBT, and medication, and individuals may require support and encouragement to engage with these. Psychosis is a condition where an individual loses touch with reality and may have delusions and or hallucinations. Delusions are believing things that are not true, and hallucinations are seeing, hearing, or feeling things that are not real. Although not real, delusions and hallucinations can feel very real to an individual with a psychotic condition, so it can be a very scary and confusing experience. Imagine having a conversation with a stranger in the park. You chat about the weather and your plans for the day, maybe even smell their perfume and shake hands with them when they leave. Then you are told there was nobody there, that it was all in your imagination. That's a very scary thought that would make you question everything your senses tell you. You would have difficulty distinguishing exactly what is real and what isn't. You may also be angry that other people don't believe you. Individuals with psychosis require a lot of support to make sense of their reality, which requires support workers to establish and maintain a bond of trust to reassure them and make them feel safe. Although the individual's experiences may not be real, it is important to acknowledge that the experience is very real to them. Individuals with psychosis may also require support and encouragement to take their medication. It is common for individuals with delusions to believe that their medication is doing them more harm than good, so it is important to help them to understand it is in their best interests to take it. However, it is also important to remember that it must still be the individual's own choice. Dementia is an umbrella term used to describe several conditions that affect the brain, leading to memory loss and difficulty in thinking, reasoning, and communicating. An individual with dementia may feel frustrated or angry that they have become absent minded and have difficulty recalling things from their memory. It can also result in them feeling confused and ashamed that they are not as independent as they once were. Dementia results in deterioration over time, so the outlook can appear bleak, which may lead to worry and even despair. To support an individual with dementia, it is useful to ensure that they feel important and valued and have systems in place to help them to remain as independent as possible. This could be as simple as an alarm to remind them when meal times are, or a diary to help them remember what they have been doing. Photo albums can also be useful for triggering long-term memories. They may require support with medication and advanced planning, which means that they are able to make decisions about their future at the present time whilst they are still able to make informed choices. Finally, individuals with learning disabilities have significant difficulties with processing, understanding, and comprehending new or complex information, which can result in difficulties with learning new skills, communicating, and being independent. Learning disabilities are lifelong conditions that stem from issues with brain development before or during birth or in early childhood. An individual with a learning disability may feel frustrated that they are unable to learn new skills as quickly as others and are dependent on others. They may also feel stigmatized by their community because they are treated differently. Therefore, it is important for support staff to show respect to individuals with learning disabilities and ensure they feel valued. Patience should also be exercised, and individuals should be encouraged to do as much as they can for themselves to increase independence and self esteem. They may require support to pay their bills, take medication, or make appointments, or understand any correspondence that they receive. The next activity asks you to explain why it is important to understand the differences between the causes and support requirements of individuals with mental health conditions, dementia, and learning disabilities. This is important because each individual is unique and they will have different needs, wishes, and preferences. By understanding the cause of the condition, you are better able to provide appropriate support. If you do not know the causes of a condition, the support that you provide may be inappropriate for the situation. For example, the reasons behind an individual displaying aggression towards others may be different depending on their condition. An individual with psychoses may be aggressive because they are experiencing hallucinations that are scaring them, whereas aggression displayed in an individual with a learning disability may be caused, for example, by them not understanding why their usual support worker is unable to visit them today. The individual with psychoses may require reassurance that they are safe and that you will look after them, whereas the individual with the learning disability may need to be left alone for a little while to calm down and then have the situation explained to them in easy to understand language. It is important to acknowledge that an individual's support needs will change over time, and their condition can have a bearing on the kind of support they will need in the future. For example, individuals with dementia are likely to lose skills over time and become less independent, whereas individuals with learning disabilities could increase their skills and become more independent. Activity 9.2a asks you to identify an attitude that could have a negative impact on an individual and the difference and the difference in impact it could have if the attitude was changed to a positive one. In my opinion, this is a poorly worded question and results in a lot of confusion from learners. It is basically asking you to compare a positive and negative attitude and describe how this could affect an individual that you are supporting. It could probably be comprehended better with an example. So, an example of a negative attitude might be that an individual with a learning disability will never be able to do their own cooking and cleaning, and it is up to the support worker to do these tasks for them. The impact this would have on the individual is that they will believe themselves that they are incapable of doing these tasks and rely on others to manage their household for them. As well as not promoting independence, it can lower the individual's belief in their own abilities to learn new skills, as well as impact on their self esteem, self confidence, and well being. They may also become frustrated that they are not being given the opportunity to learn new skills. A more positive attitude would be that an individual with a learning disability is capable of performing some or all of their cooking and cleaning themselves, and that they should be given the opportunity to learn the skills necessary to do them. Although it may take a lot of time, work, effort, and patience, a support worker that teaches and encourages an individual to become more independent is also promoting their confidence and self belief, which ultimately will impact their overall well-being. They will also be much more likely to want to learn new skills in the future. I myself have worked with several individuals with learning disabilities, and it is one of the most rewarding parts of the job when an individual learns how to do something that they have never thought possible before. Continuing with the theme of positive attitudes, the next question asks you about the social model of disability. The two main models of disability are the medical model and the social model. These models are ways of thinking about individuals with disability and the issues that they face to inform decisions about how their needs can be met. The medical model suggests that the cause of the issues that an individual with a disability faces is the disability itself, and focuses on trying to find a remedy or cure for the condition. In contrast, the social model suggests that it is society's perception and reaction to disability that is the root cause, and focuses on looking at ways society can change to provide fairness and equality to individuals with disabilities. A commonly used example is a wheelchair user that is unable to access a building because there is a flight of steps leading up to the main entrance. The medical model would suggest that the problem is with the individual's lack of mobility and focus on trying to find a cure for their condition. The social model suggests that it is the steps that are the barrier and focus on campaigning to get the steps converted to a ramp. The social model supports positive attitudes because it is not limited by the lower expectations and lack of depth of the medical model, whereby an individual with a disability must wait for a doctor or other health professional to find a remedy for their condition before they are able to fully participate in society. The social model is about finding solutions to the needs of individuals with disabilities today and changing the attitudes of society towards them. The social model also promotes person-centered practice because it aims to give individuals with disabilities as much choice, control, and autonomy in their lives as possible, and promotes respect and independence. Activity 9.3a gives you some suggested adaptations for services that support individuals with specific conditions and asks you to explain what each adaptation is and why it would be useful. The first suggestion is that workers who are supporting an individual with psychosis are given additional training. The training would hopefully explain how the condition affects the individual and the sort of feelings that they will be experiencing, as well as how best to support them. This will help them to understand why the individual may display certain behaviours and aid the development of empathy, as well as knowing what to do in specific circumstances to meet the individual's needs. Next is access to information for individuals with depression or mood disorders. Health services and charities can provide emotional and practical support and advice for individuals with mental health problems. This can include leaflets, helplines, and consultations. However, individuals with these conditions may not know they exist or not have the motivation to find out for themselves, so it is useful to provide them with the information they need to access these services and encourage them to make use of them. The next suggestion is emotional support provided by workers for individuals with an anxiety disorder. The needs of people suffering with anxiety include reassurance and having somebody to talk to about the way they are feeling. Sometimes it may not be possible to get emotional support from friends and family because they may not understand or the individual may have isolated themselves from their loved ones. so support workers may be their only outlet for this. It is useful because having someone to talk to and provide compassionate support can often alleviate anxiety or prevent it from escalating. For individuals with dementia and their family, providing access to support groups can be useful because it provides contact with others that are knowledgeable about the condition and have gone through or are going through the same thing. Peer support is especially important because it is comforting to know that you are not alone and gives you the opportunity to share experiences and give and receive advice from people that have had first hand experience and are able to understand. Finally, an occupational therapist assessment is suggested for an individual with a learning disability. An occupational therapist will visit the individual and observe how they live their day-to-day lives and offer suggestions about how independence can be maintained or improved through adaptations or learning new skills. For example, I worked with an individual with a learning disability that became very talented at cooking their own meals. However, they really struggled with peeling potatoes. No matter how much we worked at it, it seemed that he was unable to grasp the technique. So we arranged a visit with an occupational therapist. The OT observed the individual trying to peel a potato and found that he seemed unable to put enough pressure on the peeler to peel the skin of the potato off. This was not a physical disability, but more because the individual was afraid of slipping and cutting themselves. The OT produced a different type of peeler from their bag known as a Y peeler. It looks a little bit like a shaving razor, and asked the individual to give it a go. The new peeler glided over the potato and it was completely peeled in seconds. Often, an OT will be able to provide solutions that you would not have thought of yourself because of their specialisation and experience. By supporting an individual to maintain or improve their independence, the individual will have increased self-confidence, self-esteem, and overall well-being. The next question requires you to look at your own organisation's policies and procedures to identify how you would report concerns associated with any unmet needs which may arise from mental health conditions, dementia, or learning disabilities. Because the procedure will vary between organisations, it is important that you understand your own employer's protocol. If you are unable to find it in your employer's agreed ways of working, then you should ask your manager. Typical methods include reporting directly to your manager, filling in a form, or emailing a clinical member of staff. Activity 9.4a asks you to explain the 4 benefits of early detection of dementia, mental health conditions, and learning disabilities. By getting an early diagnosis, individuals may be able to begin treatment for the condition that may be able to improve their outlook or delay deterioration. Similarly, they can get early access to support services that can make living with the condition easier and are able to better plan for the future when they have an accurate prognosis. And an early diagnosis can also alleviate some of the fear and uncertainty arising from experiencing symptoms that are unexplained. Activity 9.4b asks you to explain how and why care and support may need to be adjusted following the identification of a mental health condition, learning disability, or dementia. The first scenario states that Rashid suffers from an anxiety disorder called claustrophobia. He is afraid of being in small spaces, which makes it impossible for him to go in a car or a bus or use a lift. Rashid finds using the bathroom challenging at times. Next week he has an appointment he needs to go to. It is important that Rashid is supported to attend his appointment because it may be related to his health and welfare. However, it is also important that his individual needs are taken into account. He could be supported to contact the person he has an appointment with to rearrange the venue to somewhere with more space, or even change it to a home visit to reduce his stress and anxiety. Video conferencing using services such as Zoom or Skype may also be an option. This will help him to become more comfortable and participative in the meeting. Support staff should also ensure that they provide him with reassurance and help him to use his coping strategies to manage his anxiety. The next scenario is Paul, who has dementia. Paul has difficulties with activities such as preparing meals and eating regularly. This is because he loses track of time and forgets what time he needs to eat. Support staff may need to remind Paul when it is time to eat and assist him with food preparation. Or they could arrange for assistive technology to be used, such as alarms and reminders. This is important because if Paul does not eat correctly, he could become malnourished and vulnerable to deficiency diseases. It could also be a potential health and safety risk. For example, if Paul leaves the oven on and forgets about it. So he should be supported to have smoke alarms installed if they are not already in and regularly check that they are working. This could be recorded in a logbook to remind Paul when he has done these checks. Finally, Eliza is living with Down syndrome and is finding it difficult to communicate verbally with others around her. Eliza and those around her, including her support staff, could be trained in the use of Makaton to aid communication. This will allow Eliza to express her needs more easily and maintain her independence, as well as reducing the frustration she is experiencing. Other options could include using visual aids for communication or arranging a visit from a speech and language therapist to explore other solutions. The next activity asks you to complete a table that outlines 4 pieces of legislation and policies and how they influence the experiences of individuals with dementia, learning disabilities, and mental health conditions. To begin, the Human Rights Act 1998 sets out a list of freedoms and liberties that every UK citizen is entitled to. This includes the right to respect for privacy, the right to start a family, and freedom from torture and degrading treatment. This helps protect the confidentiality and rights of individuals, promotes choice and independence, and safeguards them from abuse. The Mental Capacity Act 2005 sets out the rights of individuals that may not have capacity to make decisions for themselves. Unless there is evidence to suggest otherwise, all individuals should be assumed to have capacity, and every effort must be made to support individuals to make their own choices. In cases where an individual does not have capacity, all decisions must be made in their best interests. This protects individuals from not having the opportunity to make decisions about their own lives without justification. The Data Protection Act 2018 ensures that organisations that hold personal information about an individual keep it confidential, accurate, and only for as long as is necessary. This protects the confidentiality of individuals and ensures respect for their privacy. Finally, the Care Act 2014 puts the responsibility on local authorities to assess the needs and provide services for individuals in their region. This act helps to improve individuals' independence and well-being, allowing individuals to access the care they need before they develop into more serious needs and access to information to make informed choices. The next activity asks you to explain what is meant by the term capacity. Excuse me. Capacity is an individual's capability of being able to do something, and mental capacity is an individual's ability to make decisions for themselves. To measure an individual's capacity to make a decision, they must be able to understand the information they need, retain it long enough, and be able to weigh up the pros and cons, as well as being able to communicate their choice. Mental capacity is assessed on a decision-by-decision basis, so an individual may have the capacity to make some decisions, but not others. Activity 9.6b asks you to explain why you should always assume an individual has capacity unless you have evidence to suggest that they do not. You should always assume an individual has the capacity to make a decision unless there is evidence to indicate otherwise, because preventing an individual from making a choice contravenes their human rights and can take away their independence and confidence, which can also affect their well-being. Even if you do not agree with the choices that an individual makes or believe them to be unwise, you should always remember that it is the individual's right to make their own decisions. The next activity asks you to explain what is meant by the terms consent and informed consent, and to explain how consent may change based on the decision being made. Consent means to agree to something. In healthcare, individuals must give their consent or permission for healthcare workers to provide care or treatment. Informed consent is giving permission to receive care or treatment when all the information, including risks, benefits, and alternatives, has been provided and considered. An example of consent changing depending on the decision being made is an individual giving verbal consent for an X-ray but needing written consent to undergo surgery. A second example will be if an individual is unconscious and requires emergency treatment to save their life. In this case, the individual's consent will not be required. The final activity asks you to describe a situation where a mental capacity assessment may need to be carried out and why advanced plans are important for future care. A mental capacity assessment may need to be performed if an individual seems to lack a general understanding of why a decision needs to be made, or is unable to weigh up the risks and benefits of each choice. Similarly, if an individual is unable to retain the information they need to make a decision, to make an informed choice for long enough to make that choice, or they are unable to communicate their decision, then they may need a mental capacity assessment. Advanced planning gives individuals the opportunity to make decisions about their future care or treatments so that their wishes are taken into account if they do not have the mental capacity at a later date. For example, if they have dementia and are likely to deteriorate over time. And that's it for Standard 9. Thank you for watching, and I hope you found this video useful. If you require any additional help or want to send feedback about this video, please feel free to use the comment section below or visit my website dsdweb.co.uk. The link in the description will take you to more detailed information for this standard. And if you have not already done so, please click the like and subscribe buttons below. Until next time, goodbye.